I think as a cancer person you become an expert on pain, I suppose. And I think we're all different, but having quite a few friends with cancer now, there's lots of things we have in common, and you get to know all different types of pain.
The simplest things I couldn't do. I couldn't pick up anything off the floor. I couldn't really do any housework. Getting in and out of the car became painful.
The pain clicks in, and it frustrates you, you know. And then you're not able to do all those lovely little things you want to do, like going dancing.
You get to know whether it's low pain, medium pain, high pain, or you have this all-consuming pain that's just, you curl up like a little baby, really, and you just can't cope with that.
But generally it was just very frustrating, because you knew what you were capable of doing in a day, and suddenly you were doing 1/20th of what you really wanted to do, so it wasn't good.
I think probably the hardest part of all is seeing someone that you love going through pain and not being able to do anything about it. There's a great sense of helplessness there.
And you just can't think about anything else. And I think I was quite frightened about that when I first got a lot of cancer, and now I feel if I can control my pain, I can do just about anything.
I suppose, if you've got good relief and you look after it, well, you're on the road to a little bit of a success.
How have you been, Christina, since I saw you?
I've been really well, thanks, Fran. Yeah.
The important thing to know about pain is that it can be controlled. In order to understand exactly what your pain is like, your doctor or nurse will ask you many questions.
Yeah, well, it's really good that you've brought that up today, because we can get onto it and that way get you better pain relief.
And I guess if we get it early, it's always better, isn't it?
It's sometimes very distressing to discover that someone's been in severe pain for quite a long time, that they've suffered unnecessarily, when really a lot could have been done to help that. Patients sometimes feel like their oncologists are very busy, and that's true, but it is our job to know about pain. It's a very important symptom, and we can control it better if we know about it early.
I feel confident that if I ring up and say, well, now I've got this pain somewhere else, or I can't manage this, what do I do about this one?
If the pain is mild, then using simple pain medications, provided they're used regularly enough, may often be enough to give good pain relief. If the pain is stronger, then stronger medication such as morphine will be required, and also other medications may be helpful for bone pain or for nerve pain, and so a combination of treatments is often likely to give the best result.
Oh, hi Kerry, how are you?
I'm good, how are you getting on?
I'm going okay.
And how about the pain?
Pain can be difficult to describe. To help your doctor or nurse to know how severe the pain is and how much better it is after taking medication, pain can be measured with a pain scale.
Remember our pain scale? We've used this before, where 0 is no pain and 10 is the worst pain imaginable. So where would you sit in that scale?
I'd say it's round about 3.
Round about 3, that's on there. And what about in the last 24 hours when it's really been at its worst?
Well, yeah, by the late afternoon, I think it would go up. The worst it's been is up to about 6. And then I'd start thinking I should take something.
How do you manage to keep track of all this?
I have to write everything down. Yeah.
In a pain diary, you can record how bad the pain is, what you were doing when it came on, what pain relief you took, and how your pain responded.
So I always write down what I'm doing during the day.
Pain is a very common symptom in many types of patients, not only in cancer patients as well, such as backache, headaches, toothaches, bruises. So it is important from a doctor or nurse's point of view to make sure that we are treating the pain correctly, whether it's from cancer, whether the pain is from another cause. You can use a whole range of anti-cancer treatments like chemotherapy or radiotherapy. For example, If there's a bit of cancer in the bone that's causing pain, then radiotherapy to the bone to try and reduce the cancer can actually reduce the pain very effectively.
But you do feel a bit like a drug addict, which you didn't. You thought, gosh, I'm one of these people taking all these things, and you don't feel a lot different, and you worry that you'll be. I often ask them, oh, I'm addicted to this.
Yes, addiction is something that many patients taking strong painkillers worry about. Not only patients with cancer pain, but patients with pain that persists for whatever reason. And the short answer is that patients taking strong analgesics for pain do not become addicted. The only patients that might conceivably have a tendency to that problem are those who have formerly had a problem with drug dependence.
When thinking about drugs like morphine and other strong painkillers, it's important to remember that we use them for all sorts of medical situations, operations, and people who've had injuries and accidents, not just for cancer. And the reason is that's because they're the most effective painkillers we have. Now, what happens when you have cancer or other severe pains is the pain's like a sponge. It soaks up the morphine, and what we need to do is make sure we're adding enough to keep that sponge just full. When the pain gets bigger, we need to add more, and when the pain gets better as a result of treatment, then we shrink down the amount of pain relief so we keep it matching the sponge. That tends to reduce side effects because there's not as much free drug floating around, and it also gets around the problem of addiction. People who are addicted to pain relief do that because they don't have pain, they don't have a sponge to soak up the medication, and it has lots of other effects on their body that it doesn't have when you have pain. So morphine's the most effective painkiller that we have, and there are now lots of other drugs that are similar, so that something can be found to suit each person's needs.
It was advised that I should take a medication, and it got a little bit out of balance, mainly because the medication that I was prescribed was sort of not quite the right one.
There's a great deal of information now that shows that patients who are taking any sort of analgesics have a big difference in the amounts that they need. So we have to titrate the dose fairly carefully, and really what that means is we're tailoring the amount of medicine to your needs.
Well, the original medication I was on was making me feel nauseous and ill, so I told the radiation oncologist that I didn't really think it seemed to be doing much for me, and it was making me feel ill.
Again, it varies quite a lot. Some people are quite fortunate, and within just a couple of days we can get the dose just right, and they achieve very good analgesia very quickly. In others it may take several weeks, so it really is, again, a very individual thing.
And then in between times, if there was any little sort of surge of pain that the medication wasn't quite handling, I was able to take what they call a breakthrough.
A breakthrough medication is that when you get extra pain, you need extra pain medication or pain relievers, and that's what a breakthrough is. Sometimes you can actually take these pain medications before any activity that you know will cause pain, so as to prevent the pain rather than having the pain first and then taking the reliever.
And I have a little bottle of liquid morphine, and I take a little swig of that probably. That sounds awful. It's not a lot, but I have a measure that I put in, and I measure out exactly how much. And sometimes I plan that. Usually I only take it when I get pain, but there have been times when I know that it's on the verge of getting painful and I know I've got to sit up for a long time. So if I'm going to the theatre or something like that, I might take it in my handbag with me, so I might be able to go out at interval and measure out a little bit and have some at interval time so I can sit up for a whole performance.
Morning, Pat. How are you today?
Oh, very well, very well.
Strong pain relievers may cause side effects. These side effects often resolve after 2 days or can be managed with medication adjustments.
Have you had any problems with these?
I have had a little bit, just if I can explain it to you, mainly with the situation of constipation.
Well, constipation is a problem with this type of
Yeah.
medication.
Yeah.
You know, medicines such as morphine and fentanyl and oxycodone are typically very constipating by nature.
Yeah.
So it's very important to prevent that if
Yeah,
you can, and you know, manage it best way possible. Make sure you have your laxatives regularly.
Yeah,
Well, if you don't take them on time, you get out of balance and you can feel the pain coming back. It does come back.
One thing about pain relievers today is that we take pain relievers in cancer to prevent pain. To prevent the pain from coming on so that you're not aware of it and allows you to do your normal activity as much as possible. The painkillers are given regularly to maintain a stable blood level so that the pain is controlled all the time rather than some of the time.
We aim to manage most people's pain with medicines by mouth.
There are different routes of giving the analgesic drugs. For example, they can be given by a skin patch, and that's become quite a good option now. One of the nice things about that option is that the dose only has to be changed or administered every 3 days. The patch stays on there for 3 days. And that's another interesting option because there's some recent work that shows that constipation may well be a little bit less of a problem with the skin patch. The analgesics can be given by rectum. Some patients are quite happy with that option, others are not. So we need to talk about whether that's a good option or not. If the pain is very severe and somewhat out of control, there's a big flare-up, sometimes we just put a little needle under the skin or a little plastic cannula under the skin and infuse the analgesic drugs by an infusion. In fact, it's not just morphine that we use by that route. There are a couple of other drugs that are very, very good for managing a flare-up. In a very small number of patients, and it's probably less than 5 to 9%, we need to go to other routes, such as an epidural or a spinal route. And the advantage of that is that the doses are about 1/100th of those that are needed by infusion under the skin. So that can be a good option because, again, sedation, if it is a problem initially, will be less with that route with a much smaller dose.
It does make you really depressed. You know, I have times at home and by myself where I feel really, really desperate about things.
It is actually very common for patients with pain of any sort to feel down. When the patient gets pain, all they think about is pain, and that clouds everything else. They concentrate only on the pain. And very often, if you control pain, then that cloudiness or depression goes away. If you still feel depressed, despite the pain feeling better, then it's time to talk to your nurse or doctor again to talk about other issues that may be affecting you in some way.
To keep your sense of humour, it was very important. I'd get funny videos, anything to distract you, because I mean, even though you may not feel like making the effort to go out or to see a funny movie or to go to a play, I felt distraction was a very important part of pain relief, because I would go out and I would come home and I would realise that I had escaped it for a short time.
There are lots of other things you can use other than medications. There is physiotherapy, occupational therapy, diversional therapy.
I started acupuncture for my back, to relieve my back pain. That was very good for 2 reasons. Firstly, it did tend to relieve it. I went once a week. And secondly, I had known the acupuncturist for years and I really felt I could talk to him about problems that I weren't talking to my family about.
I do massage. There's another wonderful thing, and my husband helps massage a bit. And I bought myself ages ago a vibrator, which everybody says, oh good God, but it's not with all the pointy bits. It's one that I just do on my arm because I still have lymphedema in my arm at the moment. And if my legs ache, I use a vibrator on my legs, and it seems to, by moving the muscles, stops the aching in my bones so much. And so I think a vibrator is a really good thing for people to buy.
Play nice music and I relax with that, sit down, put the headphones on and lay on the floor sometimes with the pillow under my head and just listen to nice music. And that gives me a relief of the pain.
But I use meditation. I've been doing that from the beginning anyway, but I've made sure I did a lot more meditation, and that is a really good escape from pain.
Just right, it's the same. So we'll have a look at those pictures in a sec.
You have already met some of the team who can help with any pain you may experience. There are also many others, depending on your individual needs.
And is he booked in for next week at the cottage?
I think the pain control, it really gives you back your life. You do a bit more, you feel better about yourself, you start to look after yourself in other ways, so that makes you feel good about yourself too. And also you become part of life again. You can get out and about, you can see friends, have people over, and you're part of life again.
But if I can manage the pain that was, and work out the medication, that gave me more control, and I have more control over my life now to be able to manage to do things. So there's lots of things that change your life completely, and you have to readjust it, your whole life with your family, your friends, everything. But you can adjust it and you can have a good life still. So
I got out of bed of a morning, felt great, felt as though I was just started life again. It was wonderful. It was a beautiful feeling. You meet a neighbour in the pathway down the side of the building and say, "Gee, you're looking good today, Pat." And you're looking good because all of a sudden you've got that nice, beautiful balance of your pain relief medication, and there's nothing better.